So let's talk about constipation. This is something that frequently comes up on our Facebook page and is something that I am frantically getting messages from people in the middle of the night about because they're uncomfortable or they just don't know what to do. And so I kind of wanted to cover the basics of this. So I think there's a lot of misunderstanding. After surgery, your bowel habits will change. You will just simply not have as regular bowel movements because you're not eating as much. The volume's not there, right? Your stomach has changed in size, but your intestines has not. And so you will just have a change, so to expect that. Part of the constipation thing is just related to general anesthesia and then the pain medications that you were on. After any surgery, your gut will take a little bit of a hit. And then especially if you're combining that with any kind of preoperative diet where you just haven't been having the volume that you're used to. And then of course, after surgery, post-operatively, you're also on a very limited liquid diet. And so just the sheer volume and bulk and fiber is not there for a daily or even every other day bowel movement. Usually if people can have a bowel movement every 3 to 4 days, the first 2 weeks after surgery, that's doing pretty good. Once a week is probably, somewhat to be expected initially. If you're really uncomfortable, obviously reaching out to your surgeon or your primary care physician to see if you need to do anything in addition, but just to know that that is pretty much normal. The other thing is just a lack of activity, right? So after surgery, any surgery, you're just not moving as much, especially if it was a major operation. And so this is another one of the reasons why we really encourage you to walk. One, to get that gas out, it helps, but also it gets the bowels moving a little bit more too, to have that physical activity. If you are not moving, your bowels won't move either. So keep that in mind. So treatment, water. Again, this is another reason a lot of people get constipated after surgery. You're not drinking enough fluids. We tell you this over and over again. It's not to be mean. It is because fluid plays such a crucial role in so many different roles that our body has. And obviously having a regular poop is one of them. And so you need to drink enough fluid. That is, again, I can't say it enough. As you move on, you might want to do a stool softener as well, like a Colace. We tend to kind of be more cautious with the laxatives. You could try like an osmotic laxative, kind of like a Miralax or milk of magnesia. Those tend to be a little bit more mild, but any kind of laxative that you're using regularly, your body can become dependent on it. And so you really just want to be cautious that you're not doing that too much, and when you do kind of go off of it, you might need to sort of slowly taper it. Again, this is something that you can talk to your physician about or a nurse in your primary care clinic, whatever kind of works for you. The other thing, obviously adding more high fiber foods into your diet. Now, the first month, obviously you're doing liquids, blended, pureed foods, but you can still do a whole food diet and just put it in a blender, right? So beans, lentils, soups, steamed vegetables that have been pureed, fresh fruits, avocados are really good as well. Even like some peanut butters, almond butters, those can be really nice, ground flaxseed. I tell a lot of people to not overdo it on the baby food. We had a couple of questions about that a few weeks ago. Someone was, preparing with a lot of different baby foods. Those are fine occasionally, especially if you're traveling, but the baby food just doesn't have the fiber that a normal whole foods diet will. And so I tend to encourage you to go for the same maybe texture as the baby food, but do true food. So whether that's kind of making a soup at home and then freezing it and then blending it later down the road, or just getting canned things, that's fine too. But looking for like soups or recipes that have, again, vegetables, leafy greens, beans, lentils, flax, oats, those kinds of foods ground up and puree, maybe add some broth, gravy, whatever you need to get it into a nice smooth consistency. That's going to help you have a nice good bowel movement. Let's see, also positioning. So you know, sitting on a toilet is not exactly the most ergonomically correct way to go to the bathroom. And so, you know, getting a squatty potty, we actually have like little step stools that our kids stand on to brush their teeth. And then guess what? The grown-ups use them to go to the bathroom. So it kind of raises your knees up, your legs up, and gives you more of that like squatting position, which is a little bit more correct and sort of opens up your bowels essentially to have a more full evacuation. So there you go. And then foods, again, I talked about this, having your whole foods diet, fruits, vegetables, whole grains. The beans and the lentils, again, are super, super great because they not only give you a lot of that good fiber, but they also give you some protein too. So if you're not used to eating a lot of those, introduce them slowly. If you add too much fiber at once, it can be really difficult on your body. So going slow, again, having that fluid. If you're having a lot of dairy post-op, sometimes that can be an issue too. Some people develop a lactose intolerance right after surgery, or it can kind of develop as time goes on. So you might want to back off a little bit on some of your dairy with, you know, protein shakes and smoothies and all that stuff, you know, going for more of a dairy-free. And then maybe including a fiber supplement too, like a Citracell or a Benefiber. Both of those can be added to water, to soups, to oatmeals, really, really well. And so it's a nice, easy way to get that fiber in without having to really think about it too much. So there you go. Let me know if you have any questions in the comment section below.